Welcome to this Medway Safeguarding Children's Partnership video explainer of the Graded Care Profile 2, also known as the GCP2. This video explainer will give you an introductory set of information for those people who work in the Medway area. The GCP2 is an effective tool to identify neglect. It is a strengths-based tool that helps you assess and measure the quality of care that a child is receiving and help you to identify when a child or family is being neglected. The use with the tool and families it enables you to be quick to spot when a child is at risk. The GCP2 was developed by the NSPCC to measure the quality of care a child receives. In Medway and in other areas, it is used where neglect is known or suspected. If you would like further background information on the development of the GCP2 tool, there will be information at the end of these slides and also on our website. The tool was introduced in Medway in 2019 and locally over 600 practitioners are trained to use the tool. So what is neglect? It is the persistent failure to meet a child's physical and/or emotional needs that's likely to result in serious impairment of the child's development. It may involve a parent or carer failing to provide adequate food, shelter, clothing, or failing to protect a child from physical harm or danger. It's also the failure to ensure access to appropriate medical care or treatment. It may also include neglect of or the unresponsiveness to a child's basic emotional needs. There is a short video now from the NSPCC on the GCP2.
I'm Sue Evans. I'm a nursery manager and I've been doing that job for about 28 years.
My name is Carl Harris. I'm a training and development consultant at the NSPCC and I've now been working for the organisation for 5 years. GCP2 is a neglect assessment tool and a simple tool that can be used by a whole range of professionals across social care. The whole purpose is to measure the quality of care so we can give families the support they need.
I think what's unique about GCP2 is the actual look of the framework, the document. It's not scary, it's colourful, it's very simple to follow, and you can actually use it in partnership with the families. Because we work very closely with families, we're often the first port of call. We notice when there's a family's in crisis. I initially found out that there was a problem from a telephone call from another agency. The family consisted of very young parents living in a high-rise flat and both unemployed with 2 children. I think the stress that they were under then started to really grate. Mum was quite depressed. There was some low-level domestic violence and police had been called to the property. There was also a young baby, I think 6 months at the time. And the baby was becoming ill on a regular basis, had sort of breathing difficulties, constantly getting chest infections, and the lack of attending medical appointments with the baby. On my first visit to the home, I was immediately concerned because the entrance hall that I was invited into had got broken furniture. She'd got a 2-year-old that was obviously toddling around, running around. That was the first concern that hit me. I felt that using the GCP2 tool would be a good way of supporting Mum to evaluate where she was at and to actually give her a real objective visual of what the expected outcomes were for those children. So that's what we did. We worked together initially for her to evaluate where she was at with her family. What's significant is that she then invited me back into the home to see how things had moved forward, and they'd moved forward immensely. She'd already started to decorate. She'd attended the health appointments with the baby. Baby was signed off from the health visitor, was now thriving well. I think that had we not gone down the route of using the GCP2 tool, things might have spiralled out of proportion for this family. Ultimately, I think it could have ended up with one of the children being physically hurt and certainly emotionally hurt. Without the training that I've undergone, I would never have had the confidence to carry out a lot of the work that I now do with children and families.
We know that tackling neglect is difficult, but it's not impossible. I've been travelling the country far and wide delivering training on use of the GCP2 tool, and I do that because I've used it myself in practice. I previously used the tool as a social worker, and I've seen the difference that it can make to families, but primarily children, and keeping children safe. It is our drive to get this tool adopted by all partners within social care.
So what is the GCP2? Here's some more information. It's an evidence-based assessment tool for evaluating levels of parental care. It uses Maslow's hierarchy of needs to ensure comprehensive coverage of child's needs. It uses a graded scale from 1 to 5 to capture the levels of child's physical and emotional care. It can help to identify parental strengths and concerns, and it can help target aspects of neglectful care. It also provides evidence that can inform intervention and care planning. It can be used with single agency assessments, early help assessments, or specialist assessments. So who can use the tool? So in Medway, this training is widely available, and we have regularly trained a range of colleagues from this list, certainly social workers, family support workers, education staff, health staff, voluntary sector colleagues are welcome as well. So you can see there is a broad range of colleagues who can use this tool in working with children and families. There are benefits to the families in using this tool. We've heard about some in the video we heard from the NSPCC. Parents can be encouraged by seeing the strengths through the tool and seeing areas that they're good at, and also when they're reviewed, seeing where the improvements have been made. It gives parents a better understanding of how their behaviours may harm children, and it breaks down into priority areas so that the parents can see where are the areas they need to focus. It can also be used with adolescents and helping them understand the care they should be receiving as they transition into adulthood. So the Medway Safeguarding Children's Partnership offers free GCP2 practitioner training to multi-agency colleagues. To become a licensed GCP2 practitioner, you will need to attend a one-day face-to-face licensed training programme in Medway. The course is suited to a range of professionals, and in particular those who carry out home visits. There is further information on our website. You can also email us if you would like more information. If you're concerned about a child is being neglected in Medway, then please make contact with your safeguarding lead within your own agency and look at a referral to Children's Social Care. We may ask you if a GCP tool has been completed when you make a referral in. More information about Medway's first response service can be found here, and Medway Children's Social Care telephone number 01634 334 446, or there is a 24-hour emergency number 03000 419 191. Medway Police can be contacted on 01622 690 690, and if it's an emergency, please call 999. There is also the NSPCC helpline 0808 800 5000. Thank you for listening to this GCP2 information video explainer on the graded care profile 2.